Well, we have a very important profession on with us today. It's eye care. Dr. Derek Kunimoto, nice to have you on with us.
Thank you. Nice to be here.
Don't know what we would do without you. So you are a partner with Retinal Consultants of Arizona.
Right. That's right.
And you serve all of Arizona?
We serve all of Arizona. I come up here to Prescott once a week and service the community up here. Our practice has been doing so for about 20 years. I myself have been coming up about 8 or 9 years.
Well, an important topic. We have a lot of baby boomers, a lot of retired folks up in this area, and macular degeneration seems to be really prevalent. Is this age-related?
It is an age-related disease, and it's quite a common disease. In our country, there are estimated to be about 15 million people with the disease. That's about 5% of our population.
Ooh, so everyone has some kind of good odds to get it, unfortunately.
It's unfortunately a very common disease.
Yeah. What causes it, Dr. Kunimoto?
So the main risk factor is aging, and none of us can prevent that. But there are some other risk factors, including smoking, genetics. In terms of what we call modifiable risk factors, smoking is really the big thing that we ask patients not to do.
Is it oxygen deprivation or something, or do we know?
We don't really know, but it is thought that there's something with the smoke or one of the elements in smoking that causes some damage to the cells in the retina, which then lead to macular degeneration.
Wow. Okay, well, I guess we should. February is AMD Awareness Month,
right.
So we are being aware of
That's
macular
right.
degeneration. What is it exactly? Tell us.
So macular degeneration is age-related damage to a certain part of the retina, the macula, which is our center part of the retina, center part of the vision. And what that does is it causes distortion or decreased vision wherever we focus. So if someone's reading a newspaper, if someone's looking at another's face, that central vision is distorted or damaged.
Ooh, that's pretty bad. So how do you look at something without looking at it?
So in many cases, if patients have bilateral, both eyes diseased, then they are actually left without sight. And it is the leading cause of blindness in our population above 65 years.
I tell you, that is bad. Now, is this, if they just get it and they're in the early stages of macular degeneration, is it same where the middle vision is gone, or is it different than as it progresses?
So macular degeneration will always damage the central vision, but in early stages, that damage may not even be detectable by a patient. So it is important to get examined by an eye professional really on a yearly basis. And as we get older, that importance becomes greater. Some of the changes when the disease gets more advanced is when someone is looking at straight lines, they may notice some distortion there. And that's a sign that there may be some damage from macular degeneration. In later stages, there can be loss of that central vision.
Oh my gosh. Okay, now can this be detected early? I mean, how soon can they tell that this is something coming for you?
Quite early. There are other signs, again, where a patient may not be able to detect that we as eye professionals can detect. So it is important to get examined, especially if one has a family history. I think it's very important to get examined.
Tabs on that.
Sure.
Because is there a cure for macular degeneration?
So there's no cure, but there is quite good treatment for macular degeneration.
What is that? How do they work with that, Dr. Kunimoto?
So it depends on the stage and type of macular degeneration. Roughly speaking, generally speaking, there are two types of macular degeneration. There's dry macular degeneration and wet macular degeneration. Dry macular degeneration is the slower progressing, more benign form of the disease. Wet macular degeneration is the more aggressive, vision-losing disease. The treatments for each type is different. Of course, if someone presents early, we can monitor them and stay on top of things, because one of the keys to successful treatment of this disease is early detection and treatment. And if we catch the disease early in its stage, we can maintain that vision. There may not be a way to restore to perfect sight after damage has occurred, but we can slow down the progression.
Wow, nice. And what are the treatments? How do you handle this kind of thing?
So for dry macular degeneration, the main things we do are talk about antioxidant vitamins that can slow the aging process of the eye. The other is smoking cessation. So if someone is a smoker, smoking has been linked to advanced disease. If the macular degeneration is of the wet form, there's actually quite good treatment out there. And we wouldn't have been able to say this 10 years ago, but our treatment at this point is quite good at maintaining vision, and in many cases, up to 30% of people, we can improve vision.
Oh, that's really good. So when you get macular degeneration in any stage, how does it affect you? Can you still drive? Can you still go to work? You know, how bad does it affect you?
You know, I'd say the vast majority of people out there, it's not affecting them to the point where they can't drive, but there's a large segment of the population where it has removed people's independence, their ability to drive, their ability to write checks. There is some new technology which allows some of these most advanced cases to regain some of that independence, and I think we have some of the videos here showing an implantable telescope.
Okay, whoa, like the Hubble telescope.
Not as strong as a Hubble telescope, but in your eye.
Now this reminds me a little bit of, you know, when they peel the eye open and put in lenses if you
Yes.
have some different diseases, different...
Exactly. So it's the exact same procedure that you described. Cataract surgery, which is again a normal aging process condition, which is well treated with putting in or taking out the native lens that is clouded up, forming a cataract, and putting in a intraocular lens. This is the same technology, but instead of putting a normal lens in, we're putting a telescope in the eye. And that telescope allows one to use healthy parts of the retina to see things that they weren't able to see before.
Amazing. So this won't cure macular degeneration, but it can pretty much take away most of the symptoms?
It can allow people the ability to do things that they weren't able to do before. So, for example, check writing. You know, one of the factors of independence is being able to pay your own bills, and if someone can't do that, you know, they really are dependent on getting additional help. But if someone has a telescope in their eye and someone has the ability then to see the checks again, they can write that and be independent.
Wow, that is fascinating.
Yeah.
And breakthrough treatments, is this pretty much where it's going?
So this is one treatment. It's a surgical treatment. There are many treatments in the pipeline. There are injections that help maintain vision, in some cases improve vision, keeping vision stable for years or even decades after diagnosis.
And research is ongoing with macular degeneration, I suppose.
Ongoing. I would say that ophthalmology is probably one of the most invested in eye or specialties in medicine, and so there are literally hundreds of millions or even billions of dollars being invested in research.
Good. So by the time we get there, hopefully macular degeneration will be a thing of the past.
I hope so. I hope
Keep our
so.
fingers crossed.
Yes.
Dr. Derek Kunimoto, partner with Retinal Consultants of Arizona. Nice to have you on the show.
Thank you very much.
Thank you so much for the information.
Thank you.
Don't go away. We're going to take a break. When we come back, it's time for breakfast with Barry Barb and El Gato Azul.